Welcome back to Orlando Matters. Continue our discussion on what some folks call Obamacare and others call the Affordable Care Act with former State Representative Scott Plakon, the Republican who is running again for the House, and State Representative Joe Saunders of Orlando, the Democrat. Heading into the break, we were talking about Medicaid reimbursements from the federal government to the state of Florida. Rather, it was $50 billion over 10 years that many people thought we should have taken to subsidize the care here in Florida. Some would argue it would have created jobs, stimulated the economy. The Republican leadership in the House essentially stymied it, despite Governor Scott changing course on this, saying first he didn't want to do it and then saying we should take it. Representative Plakon, some folks just saw this as a practical matter. Take the $50 billion over 10 years, spend it so it doesn't go to another state, and help our economy. But the mindset of the leadership of the House of Representatives essentially was the federal government up in Washington is completely out of control. We can't trust Congress to make us a decent budget, so we can't rely on the money. Is that pretty much what they were thinking?
Well, I would agree with that. We're supposed to, the federal government is making a promise to us. Just like the president promises, you could keep your doctor, you keep your doctor, you keep your health plan. We now know that that's not true. Now they're promising us, if you sign up for this, we'll give you $50 billion. Well, where's that $50 billion going to come from? It's going to come from our children by putting them further in debt, and it's going to come from the Chinese, which we're already borrowing a lot of money from, and it's going to come from printing money. So Florida has drawn a line in the sand and say that no, we are going to put forth a plan like the House of Representatives did using state funds, because our economy is doing better than most of the states, and use it to provide health care for the traditional safety net people that are disabled or single moms and such. But what the House plan in Florida does not do is subsidize and provide health care to working people that are single and can fend for themselves.
And a lot of people would say it doesn't really provide much care for almost anybody. We've got 3.5 million people in Florida with no health insurance, the second highest numbers in America, and the number of people that have been covered by this plan was really small.
It's very small.
Well, that's what's
very, very small.
Well, you talk about which plan?
The House plan that never really went anywhere in the last session.
Right. Well, you go back to overall with Obamacare. The CBO just came out with a study. They're saying in 10 years, even despite of all the mandates and taxes within it, 10 years from now, there's still going to be 30 million people uninsured in the country, even when fully implemented. So, obviously, getting people health care is different than health insurance, and sometimes those two get confused. People in Florida do get health care at emergency rooms. Now, granted, that's not the ideal solution.
It drives up costs.
That's not the ideal solution, and that's one reason why Mr. Homan, who runs a hospital, they would like to see this. I mean, he runs a hospital. He wants to, those funds would go to them. I get that. But at the end of the day, I don't believe our federal government can be relied upon, and I don't think that $50 billion check is going to cash.
Yeah, I just need to respond to that, because there were two accusations. Well, let me address that first. That was one of the most frustrating arguments to hear on the floor. This idea that somehow the federal government was going to go bankrupt and not meet the obligation that they were making to the state.
But a lot of people really believe that money, that the check might not come.
And I think that there's nothing to substantiate that. Look, we have a $70 billion budget in Florida. How much of that budget is coming from the federal government every year for education funding and transportation grants? There is, and I won't know the exact number today, but it's something like half of the budget is made up of federal funds that are coming down, and there has never been a moment in Florida history where those funds did not come.
Scott, what do you say to that?
Well, about $28 billion of our $73 or $74 billion budget is Medicaid. That's up from about $9 billion 12 years ago. So Medicaid already in its current form is like Pac-Man on our budget. Essentially, by us taking this plan, it will increase that even and put a burden on the state legislature to raise taxes years later. Now, this comes down to fundamental. Wait, let me just
finish and I'll let you go.
Who do you trust? Do you trust the state of Florida and the legislature over the past few years, who has maintained and increased their AAA bond rating, or the federal government for the first time since 1917 is now decreased to a AA plus, I believe it is, and no control of the debt whatsoever? Do we believe that they're actually going to follow through with that promise?
There has never been a moment in our history when the federal government has not come due on commitments that they made. In this $50 billion that's coming in from the federal government to expand health coverage for the state's working poor, people who are working every day and still can't make it, still can't pay that premium when they need to. We have a chance to give them access to health care. And let's be clear, there is $500 million in the state budget right now that if we took this federal dollars could be shifted to other costs. We could shift it to education, we could shift it to transportation, we could fully fund our schools, we could fully fund higher education. We have a real chance to give people who need coverage, preventative care that would take care of them and make sure that their lives aren't altered for all time by illness, by a catastrophic illness that they weren't expecting. We have a moral obligation to take this money. And there's a reason, again, why the leading voices in business, the Chamber of Commerce, why every senator but one, every Republican senator in the Senate, and Governor Rick Scott all said we have to do this. Some of the most conservative state legislatures and conservative governors across the country have voted to expand health coverage for working families, and it's because they know that not doing so is economically devastating.
Representative Plakon, why did the governor change his mind on this? Was it just a matter of practicality in his view?
I don't know. I'm not in the legislature right now. I'm not privy to that. I don't know. It was surprising, I would say, because he has been, and in most cases still is, one of the biggest fighters against Obamacare, even before he ran for governor. So I don't know. But I would address one thing that Joe said with talk about education. I think you just said that it would enhance education. Well, historically, Medicaid, because of our share in paying for it with the state budget, we've had to pull money from these important priorities like education and so many other things. So there's no reason to believe that Medicaid in the future wouldn't continue to, like I called it, Pac-Man on the budget. Also, there's been a number of studies recently that Medicaid's outcomes are not even better than no health insurance at all. There's a number of studies out there.
There's $500 million in the state budget right now that's put towards a medically needy program that's state funded that covers low-income people and gives them access to health care. If we expanded health care for working families, those folks would be caught in this new web, this new donut hole that's going to be created. Folks that aren't eligible for exchange subsidies, that are at the income level, about 130% of the poverty level, that need health care through this expansion. We would have $500 million freed up in our state budget to put to other priorities. Look, in my district, the UCF Small Business Incubator, an award-winning program to create small businesses in the state, lost $1 million in the budget last year. Okay, we lauded Democrats and Republicans when we put $1 billion back into education, and we're still not back at our 2010 funding levels. What would it mean to the state and all of our different priorities to have $500 million to move somewhere else? The only reason why we rejected this funding is because of an ideological debate that House leadership has with President Obama, and it doesn't even match conservative principles. Conservatives across the country are recognizing that the economic implications for not moving on this are devastating to the healthcare system. Over $1 billion would be taken out of our Florida hospital systems because of the cuts that are coming to Medicare reimbursements. We have to do this. 60 to 100,000 jobs, Keith. $50 billion. What would that mean for Florida's economy at a moment when we're just on the precipice of getting past this recession?
It's interesting because you two just don't agree on whether or not to take it or the reasoning. We're going to take another quick commercial break. We're going to come back, talk a little more about the health exchanges to buy the insurance and coverage that go into effect this coming Tuesday. We'll be right back.